Hey team, it's been a couple of weeks since I've sent anything out, so I just wanted to give you a quick update. As we all know, the fall surge in COVID that was predicted many months ago is in full swing across our entire nation, as well as here in West Michigan. There are more people infected now and hospitalized than at any other time during this pandemic. Our local community continues to have very high positivity rates. In Muskegon County, we're at 19.8%, Ottawa, 15.4%, Allegan, 18.3%, and Kent County is at 14.6%. There are 437 people who are hospitalized at one of the hospitals in West Michigan as of today. At Life Circles, we've had a total of 29 participants and 10 team members who have had COVID or currently have COVID. And there are many more who are under investigation. Unfortunately, there are predictions that the rates will still be rising more due to the amount of travel and in-person gatherings that happened over the Thanksgiving holiday. So I just want to caution everyone, we cannot let our guard down or lose the level of urgency in practicing excellent hand hygiene, mask wearing, and social distancing. I am strongly encouraging all of you to really limit your movement in the community and to avoid in-person, inside gatherings as much as possible with people outside of your household. So the other thing I wanted to talk a little bit about is I know there are a lot of questions about the coronavirus vaccination that we're hearing about. And here's what we know as of today. There are two vaccinations, one from Moderna and one from Pfizer, that are currently in phase 3 and have applied for the FDA's emergency use authorization. This is great news. However, the supply of those vaccines is not infinite. Remember, the entire world has been waiting for a vaccine, so the resources will need to be managed according to the risk level, with an emphasis on saving as many lives as possible. So the Center for Disease Control and Prevention has an advisory committee on immunization practices, and they're responsible for identifying the priority populations for this vaccination. On Tuesday of this week, this committee voted 13-1 to give the vaccines to healthcare workers and residents of long-term care facilities first. So these individuals are considered priority 1. It will most likely take about 4 months or so to vaccinate everyone in priority 1. So if the vaccination is available at the end of December, it will take probably until April or so to get everyone in priority 1 vaccinated. You may be having questions about who is considered a healthcare worker. According to the information we've reviewed, our understanding is that hospital and institutional healthcare workers are being prioritized first, as well as residents of assisted living facilities and skilled nursing facilities. It is our understanding that Life Circles employees and participants who live in their own homes will not be considered part of priority 1 for vaccinating. However, we are following the CDC and local health department guidance closely, and we will update you as we learn more and when the vaccination gets approved, because then the plans will start to unfold. So at this point, we are hearing that priority 2 vaccinations will not be available until April or May of 2021. And that's likely when we would be able to take part in those vaccinations. I know this is hard. I also know that the next couple of months will be very difficult as the community spread continues. People are probably planning parties and gatherings and traveling over Christmas, and it's being strongly discouraged because of obviously the risk of infection. So all I can do is ask you all to be patient, to be strong, practice gratitude, and engage in safe, healthy activities over the holidays. One thing we do have to look forward to in the coming months, though, is the wonderful education and training we will be participating in with the Positive Approach to Care, or PAC. That's being led by Dr. Elam. On Wednesday, I had a chance to learn how to more effectively interact and relate to people living with dementia. It was on a Zoom call, and it was actually with Teepa Snow herself and Dr. Elam and a few others here from Life Circles. All I can say is that we are so fortunate to be able to have this wonderful opportunity. It really is exciting, and it gives us something to look forward to. Even though I thought I knew a lot about dementia and I thought I knew how to relate well with people living with dementia, I realized I still have so much to learn and so much to improve upon. So if you haven't filled out the survey yet that Dr. Elam sent out, please do that as quickly as possible. We want Life Circles to truly become the experts at caring for people living with dementia. We will be learning about this over the next several months. And it is really an incredible resource that we've been blessed with. Plus, it gives us the chance to do something other than talk about COVID while learning how to improve lives. So in closing, I just want to say that I'm thankful to be part of Life Circles. I'm humbled every day to be serving amongst you all. Please keep up the great work, acknowledge each other's gifts, and make each day count. Have a great weekend, everyone.